So, um, have you ever found yourself wishing you could unlock all the amazing benefits of high-intensity exercise?
Mm-hmm.
Building muscle, boosting your heart health, but maybe without all the heavy lifting or, like, the intense impact.
Yeah, absolutely. Maybe you're recovering from something, or just prefer a gentler approach.
Exactly. Well, what if there was a method, a way to get similar gains, but with, like, significantly lower effort?
It's a really compelling question, isn't it? For many, it sounds almost too good to be true.
Right.
But that's exactly what we're getting into today, this fascinating and increasingly popular technique known as blood flow restriction, BFR training.
That's right. So our mission today is to take a deep dive into the latest research on BFR. We're specifically looking at how different types of exercise,
Yeah.
particularly comparing upper versus lower body movements,
Mm-hmm.
how doing those with BFR impacts your cardiovascular system.
Yeah, and we'll distill the key findings so you, our listener, can quickly grasp the important insights, maybe hit a few aha moments along the way.
Think of this as your shortcut, basically, to being well-informed on this pretty cutting-edge exercise technique.
And our core source for this deep dive is a fantastic and very recent article. It's titled Effects of Acute Upper and Lower Body Resistance Exercise on Cardiovascular Response in Adult Women Through Blood Flow Restriction.
Okay.
It's authored by Choung-Hwa Park from the Graduate School of Alternative Medicine at Kyunghwa University over in Seoul, Republic of Korea.
Got it. And you can find this research is published in the Journal of Sports Science and Medicine, volume 24, pages 187 to 194.
Right.
It was accepted in early 2025 and published online March 1st, 2025. We'll have all the full details, the DOI, all that stuff in our show notes if you want to dig even deeper.
Definitely.
But first, for anyone maybe new to this, let's just unpack the basics. What exactly is blood flow restriction training?
Okay, so at its core, BFR is a method where you use an inflatable cuff or maybe a specialized tourniquet, and it's placed proximally, that just means closer to the body, like high up on your arm or your thigh on the limb you're actually exercising.
Okay, so a cuff on your arm or leg.
Mm.
I mean, that sounds almost too simple to be such a game changer. How does restricting blood flow even partially trigger these big gains? It's not like you're cutting off all blood flow, right?
Precisely. That's a common misconception, and it's a really critical distinction. The cuff is applied in a very specific, controlled way.
Okay.
It allows arterial blood flow into the muscle, but it significantly restricts, or sometimes even fully occludes, the venous outflow from the muscle.
Okay, so blood gets in, but it struggles to get back out.
Exactly. It creates a bottleneck, you could say, a pool of blood within the muscle.
That makes sense.
And this pooling leads to an accumulation of metabolic byproducts, things like lactic acid that would normally get flushed away pretty quickly.
Right.
So this metabolite buildup plus some cellular swelling and a low oxygen environment in there,
Yeah.
well, it stimulates a whole cascade of neuromuscular adaptations. It basically tricks your body.
Into thinking it's working much harder.
Exactly. Into thinking it's working much harder than it actually is, which strongly promotes muscle growth.
Now, what's really compelling about BFR, the reason so many people are talking about it, is its major advantage.
Mm-hmm.
You can get significant increases in skeletal muscle mass and strength with incredibly low-intensity workloads.
Mm-hmm.
We're talking as low as, like, 20% of your one repetition max, your 1 RM, the max weight you can lift once.
Yeah, that's tiny compared to normal training.
Right. And the gains are comparable to what you typically expect from traditional high-intensity training, which uses like 70–85% of your 1 RM.
It really is like getting stronger lifting feathers when you're used to lifting, much heavier stuff.
It's a total game changer for a lot of people.
It absolutely is. I mean, think about the wide range of individuals who could benefit. BFR training offers health advantages for young athletes looking for efficient gains.
Yeah.
All the way to the elderly who might struggle with heavy loads. It's even being explored for people with certain cardiovascular conditions. It's particularly useful as a therapeutic alternative. For patients who simply can't perform high-load resistance training, think recovering athletes, or older adults where heavy lifting might pose a risk to joints or other systems.
So it's a way to get strong without putting massive strain on the body.
Mm-hmm.
And previous research has already flagged some significant benefits, hasn't it?
Oh yeah, definitely. Studies have shown improvements in VO2 max, which is a key measure of your aerobic capacity.
Okay.
There's also evidence of improved carotid arterial compliance. That's basically the elasticity of your main neck arteries.
Oh.
And better microvascular filtration capacity in skeletal muscles. So it points to broader physiological benefits beyond just muscle size and strength.
So it sounds incredibly promising, almost like a magic bullet. But like with anything powerful in the body, there's usually a flip side, isn't there? What are some of the potential concerns or risks that research has maybe brought up?
That's a crucial point, yeah. While BFR offers a lot of advantages, it's important to acknowledge potential concerns. Now, reported side effects are generally minimal,
Okay.
but some studies have noted potential negative cardiovascular effects.
And what kind of effects are those?
Well, these could include a potential, though rare, increase in blood clots, ischemia reperfusion injury, that's tissue damage when blood supply suddenly returns after being restricted,
Right, I've heard of that.
and even some muscle damage. So understanding the body's cardiovascular response is really key to applying BFR safely.
And a big part of that response involves something called the muscle metaboreflex, or MMR. What is the MMR, and why is it so important here?
Okay, so the MMR is basically a component of what we call the exercise pressor reflex.
Okay.
Essentially, when there's a mismatch between how much oxygen and nutrients your exercising muscle needs and what it's actually getting.
Like during BFR?
Exactly.
Hmm.
Those metabolic byproducts build up. This accumulation triggers the MMR, which then signals your nervous system to increase blood pressure. It's the body's natural way of trying to force more blood to those working muscles that are kind of starved.
So BFR causes metabolite accumulation, which then logically triggers the MMR, potentially raising blood pressure.
Okay. But here's where it gets a bit confusing in the existing research, right? Because some studies actually found BFR was effective in reducing blood pressure in both people with normal blood pressure and those with hypertension.
Right.
Yet other studies observed exaggerated blood pressure responses, especially in hypertensive individuals.
Exactly. It's a bit of a paradox. And it highlights this critical need for more research, particularly into developing safe protocols that avoid excessive BP spikes during BFR.
And you mentioned most previous studies looking at potential negative effects focused mainly on lower body exercise.
That's right, primarily lower body. And this is exactly where the current study we're digging into today makes a unique and valuable contribution.
Because it specifically looked at whether upper body resistance exercise, UBRE, with BFR also triggers these excessive cardiovascular responses.
Yep. And they hypothesized, didn't they, that lower body exercise, LBRE, with BFR would actually result in higher blood pressure responses compared to the upper body work.
They did, which is a really interesting angle considering the different muscle masses involved between arms and legs.
Definitely. So let's dive into the specifics of this study then. Who participated and how did they set it up to get this crucial data?
Okay, so the researchers recruited 18 healthy sedentary women, college students aged between 20 and 30.
Right.
And it's important to note the specific criteria. They all had normal blood pressure, weren't taking any medication, non-smokers, and free of any known cardiovascular diseases.
And sedentary here meant what exactly?
It meant they hadn't done moderate physical activity for at least 30 minutes, 3 days a week for the previous 3 months. So these weren't highly active people.
Okay.
And the study's decision to recruit only women is actually pretty relevant.
How so?
Well, females are often underrepresented in exercise science, partly because of the dynamic hormonal fluctuations of the menstrual cycle, which could potentially alter or just increase variability in exercise responses. So, focusing on a single sex here allowed for a more controlled comparison. Smart move.
That is interesting. And the experimental setup sounds pretty robust. It was a crossover design, you said. What does that mean for our listener?
It means every single participant tried all 4 conditions. So, upper body with BFR, upper body without. Lower body with BFR, lower body without.
Ah, okay. Everyone did everything.
Exactly. Across 4 separate visits, each separated by 3 days. It's a really smart way to do it because each person acts as their own control.
Right. Reduces variability.
Absolutely. Makes the results much clearer, minimizes individual differences messing with the outcome. They also took careful steps like testing at the same time of day, asking participants to avoid alcohol, tough workouts, caffeine beforehand, all that good control stuff.
Got it. Now, what about the actual exercise protocol? What were they doing and how hard was it?
The resistance exercise was definitely low intensity, specifically 20% of their 1-rep max.
Wow, that's light.
Very light. Performed for 10 repetitions, 4 sets. For upper body, it was arm curls and bench presses. For lower body, squats and leg extensions. They also included a brief warm-up before each session.
Okay. And how was the BFR itself applied? Was it just like cranking down a band really tight?
No, it was much more precise and controlled than that. They used pneumatic cuffs, those inflatable bands,
Right.
set at 80% of each individual's arterial occlusive pressure. That's the pressure needed to just stop arterial blood flow.
Okay, so specific to each person.
Very specific. Cuffs were placed high on both legs and arms.
Hmm.
And interestingly, the pressure was calibrated differently for upper and lower limbs to account for the physiological differences there. And crucially, the BFR was only applied during each exercise set. Then it was released during the 30-second rest intervals between sets.
Okay, so intermittent restriction, that's key.
Very key to the technique.
And what cardiovascular stuff were they measuring to track the body's response?
They continuously measured all the key indicators. Things like heart rate, stroke volume, how much blood the heart pumps per beat, cardiac output, the total volume per minute, and various blood pressure metrics. Systolic, diastolic, mean arterial pressure. They also tracked total peripheral resistance, or TPR.
What does TPR tell us, Sigal?
It tells us how constricted or relaxed the blood vessels are overall. Higher TPR means more constriction.
Got it.
And these measurements were taken continuously, from rest all the way through the exercise and deep into recovery up to 40 minutes post-exercise. They used a non-invasive device for real-time data.
Okay, so they gathered a really comprehensive picture of what was happening inside these participants' bodies. After all that meticulous measuring and analysis, what were the core findings? What did this research actually reveal about BFR and cardiovascular response?
Well, the central finding, the main takeaway, was actually quite positive. Low-intensity, lower body resistance exercise, LBRE, with BFR, had an overall beneficial effect on the cardiovascular response, both during the exercise itself and during the recovery period in these women.
That's excellent news. But were there differences between working the upper body and the lower body when BFR was applied? Because they hypothesized there would be.
Absolutely, and the differences were quite significant, just as they thought. LBRE with BFR, so lower body work, resulted in greater increases in diastolic blood pressure and mean arterial pressure during exercise compared to the upper body resistance exercise, the UBRE, with BFR.
Okay.
LBRE with BFR also showed higher heart rate and cardiac output during both exercise and recovery compared to UBRE with BFR.
So the lower body work definitely kicked the cardiovascular system into a higher gear, so to speak. But here's where it gets really interesting, maybe counterintuitive. What about that total peripheral resistance, the TPR? You might expect it to go up with restriction, but what did they find?
Yeah, that's the fascinating part. Intriguingly, TPR was significantly decreased during LBRE with BFR compared to UBRE with BFR.
Decreased. Wow.
Yeah, decreased. And this reduction actually persisted throughout the entire recovery period. It suggests a very different and potentially quite positive vascular adaptation happening specifically in the lower body.
That is interesting.
On the other hand, systolic blood pressure, the top number, didn't show a significant difference between upper and lower body exercise when BFR was used.
Okay, so LBRE with BFR really affected DBP, MAP, HR, CO, and especially TPR more than UBRE. What about comparing BFR to non-BFR conditions just generally? Were there overall trends?
Yeah, there were. Across both upper and lower body exercises, applying BFR generally led to greater diastolic blood pressure and mean arterial pressure during the exercise itself compared to the non-BFR conditions. That kind of makes sense, right? The restriction causes pressure to build up a bit.
Right, seems logical.
However, systolic blood pressure generally decreased after about 10 minutes of exercise in all conditions, BFR or not.
Oh, why is that?
The authors attribute that to what's known as a post-exercise hypotensive effect. Basically, a beneficial drop in blood pressure that often happens after exercise finishes. And as you'd totally expect, heart rate and cardiac output consistently decreased during the recovery period after exercise stopped, regardless of whether BFR was used or not, the body calming down.
So what does all this mean for us? Why does this research matter to someone maybe thinking about trying BFR or just trying to understand how exercise impacts their body?
Well, what's fascinating here is how BFR stimulates that exercise pressure reflex, the EPR we talked about.
Right, through the lack of oxygen.
Exactly, through tissue hypoxia, low oxygen. When those working muscles don't get enough O2, the central nervous system responds. It increases heart rate to try and pump more blood to those tissues, which in turn increases the cardiac load, how hard the heart is working.
So it's the body's natural response trying to overcome that partial restriction.
Yeah.
And you mentioned the muscle metaboor flex, the MMR, earlier. How does that tie in again?
Yes, good point. Both the metaboreflex caused by that buildup of metabolites like lactic acid and the muscle mechanoreflex, which is triggered by the physical compression from the cuff itself, both are key regulators of this EPR.
Okay.
And both are definitely increased during BFR exercise. So you've got these mechanisms working together, driving the cardiovascular changes we see in the study.
What about those blood pressure insights? Especially that significant drop in diastolic pressure during recovery after the lower body exercise.
Yeah, that decrease in diastolic BP during recovery after LBRE, which happened even without BFR in this study. It might be linked to that post-exercise hypotensive effect we mentioned, and also that lower total peripheral resistance.
Oh, okay.
It suggests a beneficial effect on blood vessel dilation, especially after lower body exercise, kind of promoting healthier blood flow once the exercise is done.
So even with those acute increases during exercise, there seems to be a beneficial recovery response afterwards. But the study also mentioned something about potential circulatory implications for people with pre-existing cardiovascular disease.
Yes, and that's a really crucial point to consider, even though this study was in healthy women. They found that while cardiac output, the total blood pumped, increased similarly whether BFR was used or not.
Right.
Stroke volume, the amount pumped per beat didn't really change significantly with BFR, but heart rate did increase.
So the heart was beating faster, but not necessarily pumping more blood with each beat.
Exactly, which could suggest potential circulatory challenges for individuals who already have cardiovascular issues. Their heart might be working harder, compensating with rate, without a corresponding increase in efficiency per beat.
That's a really important consideration for safety and application.
Definitely. It's something that needs more research, especially in those specific populations.
And what about that notably higher heart rate they saw during lower body BFR compared to upper body BFR? Any thoughts on why that might be?
Well, that higher heart rate during LBRE with BFR could be linked to the baroreflex. That's your body's built-in system for regulating blood pressure.
Okay.
Since your leg muscles are much larger and demand more blood flow, the greater restriction effect there might trigger a stronger signal via the baroreflex pathway, telling the heart, hey, pump faster, to maintain overall pressure and perfusion. It's likely a complex interplay.
So the big aha moment for you, our listener, might be this. While low-intensity lower body BFR training does make your heart work harder during the exercise itself, causing those temporary bumps in heart rate and certain blood pressures, the really interesting finding is that significant reduction in blood vessel resistance, the TPR, especially during recovery.
Yeah, that's the key takeaway.
It suggests a potentially powerful positive adaptation for your blood vessels, maybe offering unique cardiovascular benefits that other types of exercise might not emphasize as much, particularly post-exercise.
Right. It's not just about muscle. It seems to be influencing vascular health in a really interesting way, a smart adaptation by your body, perhaps.
This research definitely gives us some clear insights, but, no study is perfect. What are some of the limitations or nuances we should keep in mind from this specific paper?
Yeah, the authors themselves were good about highlighting two key limitations. First, the participants were all healthy, sedentary, young adult women.
Right.
Which means the findings might not directly apply to other groups, older adults, say, or highly trained athletes, or patients with specific health conditions like hypertension. We just can't assume the same responses would happen in everyone.
So don't extrapolate too broadly.
Yeah.
Got it. And the second limitation?
This was an acute study, a short-term look. It examined the immediate cardiovascular responses during and right after single exercise sessions.
Okay.
It didn't evaluate the long-term effects or adaptations you might get from BFR training over weeks or months. So while we see these acute positive signs, we don't yet know the full picture from chronic, regular training.
That makes perfect sense. So looking ahead then, what's next? What does this research suggest needs to be studied further?
Well, the authors strongly emphasize the need for future research, specifically long-term training studies.
Right, to see the chronic effects.
Exactly. Those would be crucial to really confirm and maybe differentiate the long-term cardiovascular responses between upper and lower body BFR exercise when people do it consistently over time. It's all about building a more complete understanding, its potential, its nuances, how to use it most effectively and safely.
And that brings us towards the end of another deep dive. This journey has really shown us how low-intensity resistance exercise with blood flow restriction, particularly for the lower body, seems to have this positive overall effect on cardiovascular responses, both during exercise and in recovery. Despite some of those acute changes in things like heart rate and blood pressure, it offers a really fascinating glimpse into how we might be able to optimize exercise for more diverse populations, making effective training accessible to more people.
Exactly. And considering these findings, it really makes you wonder, doesn't it? How might personalized BFR protocols be developed down the line
Yeah.
to really maximize the benefits while minimizing any potential risks for different individuals, especially people going through rehab or those with specific health considerations? The potential for really tailored exercise programs seems immense.
Absolutely. Now, if you want to dive even deeper into the specific methodologies and all the detailed data from this study, we definitely recommend reading the full article by Choung-Hwa Park. It's in the Journal of Sports Science and Medicine.
Yep, and you can find all the publication details and the DOI link right there in our show notes.
And remember to stay well informed and never miss another deep dive into compelling research and, surprising facts.
Be sure to follow the Deep Dive channel and turn on your notifications.
Until next time.